Well-being talk in day-to-day existence. Medigod, liver transfer that can treat liver sickness and liver malignant growth simultaneously. Liver transplantation is a therapy choice for patients experiencing different liver illnesses who can't be treated by traditional clinical or careful strategies and the illness keeps on advancing. An astonishing clinical procedure can supernaturally give another life on the off chance that a decent liver is relocated brilliantly regardless of whether a solid individual's liver weakens quickly or a patient with liver sickness decays because of contamination or draining and appears to be difficult to recuperate. In Korea's conventional fantasy, Byeoljubujeon, there is a story that the mythical beast lord, who is going to kick the bucket, needs to eat a hare's liver to recuperate from his sickness. Maybe the hare's liver is great since it mostly eats new vegetables and is dynamic while going around in a perfect regular habitat. Then again, it very well may be expected that the winged serpent lord's liver got terrible in light of the fact that he ate a ton of liquor and oily food in the royal residence, got help from different workers and servants, and didn't practice by any means. The legend that the winged serpent lord helps another life through a bunny's sound liver makes us keep thinking about whether our predecessors had an understanding into liver transplantation. Likewise, I estimate that homegrown liver transfer results, which are showing great outcomes around the world, are demonstrating it. Most liver malignant growth patients have liver infections like ongoing hepatitis or cirrhosis. Consequently, liver transplantation can be supposed to be the best therapy to treat liver malignant growth all the while with existing liver infection. Among different therapies for liver malignant growth, liver transplantation has the most elevated endurance rate, and the insights that the repeat rate after liver disease treatment is low demonstrates this. Likewise, liver transplantation is the main strategy that can be applied regardless of whether liver malignant growth can't be relieved because of serious liver cirrhosis. Be that as it may, liver transplantation is workable for all patients with liver disease, and the outcomes are bad. In the illness assessment stage, there should be malignant growth just in the liver, no metastasis to different organs, no intrusion of significant veins, and little cancers with few growths to accomplish great outcomes after liver transplantation. Fortunately, through the new improvement of different prognostic elements for liver transplantation, it has been accounted for that even situations where a decent guess can't be anticipated from liver transplantation show great outcomes on the off chance that the reaction to liver disease therapy performed before a medical procedure is great or the degree of malignant growth markers is low. Some marvel, since the whole liver is taken out, liver disease shouldn't repeat, assuming that liver transplantation is performed regardless of whether the cancer is extremely huge and various. Be that as it may, regardless of whether the whole liver is eliminated, liver disease can repeat because of liver malignant growth cells staying in the blood or liver disease cells found someplace in the body on the off chance that the current liver disease is extreme. Liver transplantation can be isolated into perished liver transplantation and live halfway liver transplantation, relying upon the strategy for getting another organ. Mind-dead liver transplantation includes relocating the liver of a cerebrum-dead benefactor, and the patient with the most terrible liver at the hour of mind-dead passing is chosen as the main transfer beneficiary. In spite of the fact that it enjoys the benefit of having the option to relocate the whole liver, there are cases in which the mind-dead individual is old or has greasy liver, and by and large, the organ condition is generally poor because of issues, for example, make a trip time because of the irregularity between the medical clinic where the cerebrum demise happened and the transfer medical clinic. Fractional liver transplantation is a technique for giving just a part of a solid individual's liver, and enjoys the benefit of getting a transfer in the best condition, albeit the size of the liver to be relocated is little. Since the quantity of cerebrum-dead patients in Korea is low, it is extremely challenging for liver disease patients with moderately great liver capability to get benefactor livers from mind-dead patients, so a large portion of them get fractional liver transplantation. There is little distinction in the treatment results after a medical procedure as per the two techniques. Liver transplantation is perhaps of the most basic and troublesome careful activity, and the transient dangers presented by the activity should be thought of. Immunosuppressive medications should be taken forever, and entanglements might happen, so consistent administration is required. Be that as it may, the consequences of liver transplantation are further developing thanks to the advancement of careful procedures and patient administration when medical procedure, as well as the improvement of immunosuppressants and different hepatitis infection therapies. As of late, the 10-year illness-free endurance rate after liver transplantation in liver disease patients is more than 70%. Liver transplantation is troublesome, moderately hazardous, and requires long-lasting administration. However, a treatment brings great outcomes as well as return to society and free active work after a medical procedure. Teacher Jung Dong Won, Division of Hepatobiliary Medical Procedure, Asan Clinical Center.